It is one thing to grow old and another to go bald. And the truth is that most Kenyans fear receding hairline. But today I have got good news from Dr. Dindi, who is a hair trichologist and is going to take us through the hair transplant process. And the first question to Dr. Dindi, can you please explain to us what is meant by hair transplant?
Actually, to say hair transplant, many times when people think of transplant, they think of like kidney transplant, where you're getting tissue from somebody else to another person. But really, for hair transplant, you're getting hair from one part of somebody's own body to another. Usually from one part of the scalp where there is hair to a part that is balding. So that process, we call it a hair transplant.
And why do people do hair transplant?
There's something in medicine, we call it reconstruction, So if, for example, somebody has had burns of the scalp and they've lost hair on the scalp, then we can be able to get hair from one part and transplant it to that part so that you are kind of giving them a look that is aesthetically appealing. But also for cosmetics, for cosmetic surgery. So people, maybe somebody just losing hair because they have got a genetic form of hair loss. They're not happy with how their scalp is looking, and so we can still be able to get hair, maybe to restore their hairline.
Are there types of hair transplant?
There are different types of hair transplant. Hair transplant really has gone through an evolution. The first people to do it were the Japanese a long time ago after the Second World War, and the techniques that they were using were, if you can use the word, crude, because they were really at the beginning, the evolution of hair transplant. So they would get plugs of hair and plant them, and they did not really have a natural aesthetic look to it. But the method that is now used was described by an Australian doctor. He was called Dr. Wood, and we call it follicular unit extraction. So it's a method where we get individual units or individual follicles from the donor area and transplant them to the recipient site.
And what are there long-term effects of hair transplant?
So when it comes to the side effects, one of the things that is good about hair transplant, you're not getting tissue from somebody else. So you're getting the follicles from somebody's own body, just moving them from one place to the other. So you don't have any of the untoward effects like what you have when you've transplanted a kidney or liver, where somebody has to be on anti-rejection medications for life, essentially. So for hair transplant, we don't have any of those. The issues are usually really short-term. So somebody, for example, might have a bit of itchiness on the scalp. Somebody might have some headache immediately after the procedure. But once the inflammation settles down, you're really good to go.
And are there health issues that can deter one from undergoing through the process of hair transplant?
If somebody has uncontrolled diabetes, then they cannot get the hair transplant done, because then that affects the healing. If somebody is severely anemic, that is, the blood levels are very low, they cannot have this procedure done, because after the procedure, then the healing or nutrition to the follicle is interfered with. People with hypertension that again is not controlled, we cannot do the procedure because that high blood pressure can cause a lot of oozing when the procedure is being done. The other conditions are autoimmune diseases. These are diseases where the body is, quote in quotes, fighting itself.
Doctor, you can tell us, how have Kenyans embraced hair transplant today? Have they embraced it in a good way, or are they still negative about it?
I've been doing this now for about 5 years, and at the beginning, a lot of people were skeptical. Does it work? Will the results last? Things like those. But over time, we've noticed more and more people are coming through, more and more people are believing that yes, this is something that can actually work, especially now that we have lots of clients whom we have done the procedure and they're doing well.
What causes hair loss in a human being, maybe male or female?
Self-inflicted form of hair loss, we call it traction alopecia, is the commonest. But there are other forms of hair loss. We have genetic hair loss, so what we call male pattern, and female pattern hair loss. Then we've got hair loss due to certain medical conditions. So patients who have got some autoimmune conditions will start losing hair. But we also have hair loss because of mineral deficiencies. People who have especially deficiency in iron, vitamin B12, they start to notice that the color of the hair is changing, or the hair is becoming thinner and thinner, and finally that hair disappears. There are also people who are losing hair because of the medications they're using. Others, a lot of women after delivery, they notice that they're losing hair. So there's a postpartum form of hair loss. We call it postpartum telogen effluvium.
It is now that time that it is getting more exciting, especially for me as I join in Dr. Dindi, who is going to take us through the process of hair transplant from the first stage up to the last stage. Join me through. This is the most intense that I've got to see in the skin therapy, and I have a lot to digest. So join me in the second part of the hair transplant so that we can see on the progress that it has undertaken during the rebuilding of the hairline. Njeri Njogu for Ebro TV.